After aging, some of the most dangerous health changes are the ones people don't notice at all after aging. The body naturally changes in many ways, but not all changes are harmless or simply normal aging, because some can be early signs of health conditions that need attention. Point 1. One of the earliest changes is reduced energy levels. This is not just normal tiredness after activity, but a consistent feeling of fatigue, even during simple daily tasks like walking short distances, bathing, dressing, or light housework. Medically, this can be linked to reduced heart efficiency, lower lung capacity, anemia, thyroid imbalance, chronic inflammation, or insufficient nutrition intake. The important part is not occasional tiredness after exertion, but a pattern where the body feels drained almost every day, without a clear reason over time. This can gradually reduce independence, making even simple routines feel more difficult than before. Because this decline happens slowly, many people adapt to it without realizing that their baseline energy level has significantly changed. Point 2. Another common change after aging is balance instability. Some individuals begin to feel unsteady when standing up, walking on uneven surfaces, or turning their head or body too quickly. This can be related to reduced muscle strength, slower reflex response, changes in vision, nerve sensitivity issues, or inner ear conditions that regulate balance. Even if the instability feels mild at first, it should not be ignored because small balance issues can significantly increase the risk of falls. In older adults, a fall is not just a minor accident, as it can lead to fractures, head injuries, or long recovery periods that affect overall mobility and independence. This is why repeated episodes of unsteadiness are considered an important warning sign in medical evaluation. Point 3. Reduced appetite is also frequently observed after aging. While it is often dismissed as a normal part of getting older, the body still requires sufficient calories, protein, vitamins, and minerals to maintain muscle strength, immune function, and organ health. Loss of appetite may be influenced by multiple factors, including changes in taste and smell, dental or chewing problems, medication side effects, digestive issues, or emotional conditions such as loneliness and low mood. In some cases, it develops so gradually that the person does not notice they are eating significantly less than before. If this continues over time, it can lead to unintended weight loss, muscle wasting, and reduced resistance to illness. This is why long-term appetite changes in older adults should always be monitored rather than ignored. Point 4. Sleep quality often changes after aging, including lighter sleep difficulty, staying asleep, waking up multiple times during the night, or waking up too early and being unable to fall back asleep. These changes can be influenced by shifts in the body's internal clock, reduced physical activity, chronic pain, medication use, or underlying health conditions. While some sleep changes can be expected with age, persistent poor sleep can affect memory, mood stability, energy levels, and overall recovery of the body over time. Poor sleep quality can also worsen other health conditions, creating a cycle that affects daily functioning. Point 5. Short-term memory changes may become more noticeable after aging. This can include forgetting where items are placed, repeating questions, misplacing objects, or having difficulty remembering recent events or conversations. However, it is important to understand that not all memory changes are signs of serious cognitive disease. Stress, anxiety, poor sleep, depression, and certain medications can also contribute to forgetfulness. The key concern arises when memory problems begin to interfere with daily independence, such as difficulty managing finances, following routines, or recognizing familiar tasks. In such cases, further medical evaluation is often recommended to understand the underlying cause. Point 6. Mood changes can also occur after aging, including increased irritability, anxiety, emotional sensitivity, or periods of low mood without a clear external reason. These changes may be related to hormonal shifts, social isolation, chronic illness, or reduced physical activity. Emotional changes are often overlooked, but they can significantly affect appetite, sleep quality, and overall motivation to stay active. If mood changes persist over time, they can also contribute to physical decline by reducing engagement in daily activities. Point 7. Physical strength may gradually decline, making everyday movements more difficult than before. Activities such as standing up from a chair, climbing stairs, carrying light objects, or walking longer distances may start to feel more tiring. This can be related to natural muscle loss with aging, a condition known as sarcopenia, as well as reduced physical activity or underlying chronic diseases. In medical assessment, declining physical strength is an important indicator because it reflects overall functional health, not just muscle condition. If left unaddressed, it can lead to reduced independence and higher risk of falls or injury. Point 8. Some individuals may experience dizziness when standing up too quickly, which is often related to blood pressure regulation, changes known as orthostatic hypotension. This can happen when blood flow adjustment becomes slower, with age causing temporary lightheadedness or imbalance. Although it may seem brief, repeated episodes can increase the risk of falling and should be monitored, especially if it happens frequently. Point 9. Bowel and bladder patterns may also change after aging. This can include more frequent urination, difficulty holding urine, constipation, or changes in regular bowel movement patterns. These changes may be influenced by diet, hydration levels, physical activity, medications, or changes in muscle control. While some variation can be normal, sudden or persistent changes should be observed, as they may indicate underlying digestive or urinary conditions. Point 10. Skin may become drier, thinner, and more sensitive after aging. Minor cuts or injuries may also take longer to heal compared to earlier years. This is often related to reduced collagen production, lower skin elasticity, and decreased blood circulation to the skin. Although usually not dangerous on its own, slower healing can increase the risk of infection if injuries are not properly cared for. Point 11. Vision and hearing may gradually decline over time. This can include difficulty seeing in low light, blurred vision, trouble focusing, or needing higher volume to hear conversations clearly. These changes often develop slowly, making them easy to adapt to without noticing how much they have progressed. Regular eye and ear checkups are important, as untreated sensory decline can affect safety, communication, and independence. Point 12. Sensitivity to cold may increase after aging. Even in temperatures that previously felt comfortable, this can be related to reduced circulation, lower body fat levels, slower metabolism, or hormonal changes. While often harmless, persistent intolerance to cold can sometimes indicate underlying metabolic or thyroid-related issues. Point 13. When several of these changes occur together within a relatively short period, such as reduced energy, weight loss, appetite decline, and reduced physical strength, it should not be ignored from a medical perspective. This pattern may suggest that the body is undergoing more complex changes that require evaluation, rather than simple age-related decline. Routine medical checkups such as blood tests, blood pressure monitoring, nutritional assessment, and functional evaluation can help identify potential causes earlier and prevent further deterioration. After aging, the body will always change, but paying attention to the early signs can help maintain health, independence, and quality of life for longer.